ACLS Guidelines, Cardiac Arrest Management. In this lesson, we will discuss Advanced Cardiovascular Life Support, ACLS. ACLS is a set of protocols and interventions designed to aid in the resuscitation of patients who are experiencing cardiac arrest or other life-threatening conditions. ACLS guidelines involve a variety of medical equipment and techniques, including airway management, defibrillation, medication administration, and cardiopulmonary resuscitation, CPR. One of the most common scenarios where ACLS is used is in the case of ventricular fibrillation, which is a type of cardiac arrest where the heart's electrical activity becomes chaotic, preventing the heart from effectively pumping blood. In the event of ventricular fibrillation or other life-threatening arrhythmias, immediate defibrillation is necessary. This is achieved through the use of an automated external defibrillator, or manual defibrillator, which delivers an electric shock to the heart to restore its normal rhythm. ACLS also involves advanced airway management techniques, such as intubation, to ensure proper oxygenation and ventilation of the patient. Intravenous, IV, administration of medications, such as epinephrine or amiodarone, is also a crucial component of ACLS guidelines in order to manage the patient's cardiac rhythm and blood pressure. If the patient remains unresponsive or has no pulse, CPR should be immediately initiated. High-quality chest compressions, along with proper ventilation and defibrillation, can greatly increase the chances of a successful resuscitation. Throughout the entire resuscitation process, it is important to constantly monitor the patient's vital signs, such as blood pressure, heart rate, and oxygen saturation. When a patient experiences a cardiac arrest, it is important to initiate the ACLS protocol immediately. This involves a series of steps aimed at identifying and treating the underlying cause of the cardiac arrest. The first step in the ACLS protocol is to assess the patient's responsiveness and breathing. If the patient is unresponsive, not breathing, and/or has no pulse, begin cardiopulmonary resuscitation, CPR, immediately. Once CPR has started, attach a cardiac monitor to the patient to determine the cardiac rhythm. If the rhythm is not shockable, continue CPR and administer medications as appropriate. If the rhythm is shockable, prepare to deliver a defibrillation shock. Clear the area and ensure that everyone is away from the patient before delivering the shock. After defibrillation, administer medications such as epinephrine and amiodarone as appropriate. These medications can help to stabilize the heart rhythm and improve cardiac output. During the resuscitation process, it may be necessary to establish an airway for the patient. This can be done by inserting an advanced airway device, such as an endotracheal tube or supraglottic airway. Continuously check for a pulse and blood pressure during the resuscitation process. If there is still no pulse, continue CPR and administer medications as necessary. If the patient remains unresponsive and without a pulse despite these interventions, consider other possible causes of the cardiac arrest. If no pulse, breathing and/or responsiveness is present for a continued length after or during ACLS implementation, it may be necessary to cease resuscitation efforts. If there are signs of biological death of the brain and brainstem, it is necessary to immediately cease resuscitation efforts to avoid wasting resources. Post-cardiac arrest care should also be implemented, This includes pharmacological therapy, continued monitoring such as serial ECGs, hemodynamic monitoring and neurological support.
Thank you for participating in this medical department educational video. This video was brought to you by the SCPF Medical Department Medical Student Educational Services.